gaps in the market would be the desperate need for there to be an integrated system, for the healthcare to be able to speak from the patient, from admitting into the hospital, from the patient being into the community. I would honestly say the gaps would be also education and awareness of what is out there and what are the treatments that they have out there.
So what would you say are the emerging markets?
The emerging markets would be wellness programs, surgical centers, hospitals, and definitely a transitional care market.
How do you think healthcare delivery models are changing in response to developments in digital healthcare?
The healthcare market is changing with going integrated into a digital EMR system because it's allowing for the patient to have their medical records to be accessible for physicians. So it is allowing for accuracy of medical treatments. It's going to cut down on the medical waste that is being treated for a patient that has to go into one hospital or one pharmacy and there's no one communicating on that patient's care. It's going to help us on mismedication and mismanagement of their treatment. So I think it's going to cause for a better healthcare system.
Which areas of healthcare do you think investors will be interested in?
Hospitals. I believe they'll also be interested in companies that can come with turnkey healthcare solutions, surgical centers. I believe that they'll want to partner up with people who can come in and provide the resources. That'll be areas they'll want to invest in.
And finally, how has your overall experience been with the event?
It's been very positive. We started this with a vision 2 years ago, and we utilized Informa to be our vehicle. We started with a very small booth just to kind of gauge the region and the feedback that we would get from the region. By doing that, it was so instrumental in us deciding that we wanted to formulate a healthcare consortium. And through that consortium, we spent the past 2 years, Mark, with Well and Able, and my uncle, Captain Jack Ahart, and we have about almost 30 other entities that have over 24 years of experience and expertise in their own divisions to come together and be a true turnkey healthcare solution. And by doing that, we ended up joining into Arab Health. We had a little bit larger of a booth. We did so well. We had 2 new clients. By 6 months later, look at this, we decided to do platinum sponsorship. And this event has been so powerful that we've had people who've sent representatives just to do fillers yesterday, that the decision makers came back today. We've had 3 saying they didn't even think to even come to the event. But after coming here, they found that companies such as ourselves are a resource. It was so moving that they ended up walking around and finding other businesses and other interests. So I would say this event's been very successful for us.
Well, the lady says it all.
Yeah, I think she said it all. No, it's been really great.
But we are definitely, I mean, our goal is to change the healthcare capabilities of the region. You know, and not that it's wrong now. It's just that anything that exists can be better, and our desires are to make things better.